nudging us towards the fifth wave of public health new practices and policies. We're going to get started in just a couple of minutes, and we'll go ahead with an official welcome and start recording our session so that we can make it available to people after today. But before I do that and officially start the webinar, I wanted to do a quick run through of some of the technical aspects of how the webinar technology works. So just do a quick orientation before we officially start. So a couple of things many of you have already seen on the screen. First of all, we're using our audio through a teleconferencing system, so you'll want to mute your phone line so we don't get any feedback throughout the call. And you mute by pressing *6, and you can unmute at any time if you want to contribute verbally to the conversation by pressing *6 again. But throughout the presentations, we ask that you keep your phone line muted. You'll also want to mute your computer speakers. Sometimes we get some feedback from computer speakers and audio through your computer. And you'll do that if you look at your webinar screen, the top toolbar moving from left to right, you'll see an icon that looks sort of like an audio speaker. There's a drop-down menu, and you can hit, using the drop-down menu, mute my speaker. So you want to mute your speaker and mute your phone. And then a couple of other things that we'll be using throughout the webinar. We're hoping, in addition to our guest speakers and our panel, we'll have the opportunity to have some good dialogue and conversation. And we do that either through conversation you can contribute on the phone line or using our chat room. So if you look at your screen, you'll see a blue screen that says welcome to the webinar. To the right, you should see 3 boxes, one that says attendees, one that says chat, and one that says files. Chat room is an opportunity where you can contribute throughout the call at any point with any questions or comments that you have about the presentations, if you have a specific question for the presenters. And you just type in right below the chat box, there's sort of a rectangular box with a flashing cursor. You can type your questions or comments in there at any point. And we really would like to encourage participation as much as possible, so please feel free to use that if you have any specific questions or comments. And finally, the other feature that I wanted to point out is an opportunity for you to give us feedback throughout the webinar using what's called Set Your Status. So again, looking at the top toolbar, moving from left to right, you'll see on the left it should say meeting, and then you move to the right, you'll see the icon for the audio. And at the far right, there's a little icon of a person with their hand up. If you click on that, there's a drop-down menu, and that enables you to set your status. I'm just getting some feedback right now, so you'll want a reminder just to mute your phone line by hitting *6 so we don't get the feedback. So the Set Your Status is an opportunity for you to answer questions or let us know how you feel about things throughout the webinar. So just to test it out, if everyone can raise their hand, you just click the drop-down menu and click Raise Your Hand. Let's see if everybody can make that work. See lots of hands going up. Great. Wonderful. So we'll be using that as well for a couple of activities where we want to get feedback from you if we have questions and want to hear from you. And you can also, if you have a question at any point, you can hit the raise your hand icon to let us know that you have a question, and I'll be moderating the session. And questions you have at that point. Great. So I'm going to go ahead now and start recording the session, and we'll officially begin.
The conference is now being recorded.
So welcome everyone to today's webinar, Nudging Us Towards the Fifth Wave of Public Health New Practices and Policies. My name is Stacey Barter, and I work with BC Healthy Communities, and I'm going to be facilitating today's webinar session. We're very, very excited to have 2 fabulous guest speakers with us today to share in today's webinar session. Dr. Phil Hanlon is back for the 2nd time. We had a great webinar with him in April, so we're so thrilled that he's back to share more with us. As many of you know, Dr. Hanlon works with the University of Glasgow in public health, and he has an extensive history of working in public health in Scotland, including working to establish the Public Health Institute in Scotland. And he'll be sharing a bit more about his work, in particular some fabulous research that he's been doing through a really interesting project called the After Now Project. So welcome back, Phil. We're so excited that you're here, and so excited, too, that we're joined today by our colleague Melanie Sondergaard, who works with the Storytellers Foundation in Hazelton. Melanie, as many of you saw, her colleague Anne Doherty was meant to be on the call today, but as things go, Anne is traveling and does not have access to technology as she's on the ferry between Port Hardy and Prince Rupert. So we're so thrilled that Melanie was able to join us. Melanie's worked with Storytellers for the past 11 years, so she has tons of experience on the ground, working mostly with young adults, leading community economic development activities in the small communities there. And she's going to share some really practical examples of the work that they've been doing around policy development with young people. So welcome to both of you. We're thrilled that you can be on today's call. The session today is really to go a little bit deeper with the call we had in April with Phil, looking at emerging ideas of how can we create comprehensive change in our approach to public health, and how can we get creative around addressing complex issues such as chronic disease prevention and creating healthier communities. And we're hoping today to particularly take the conversation to looking at the role of policy development and how can we work together to create healthy public policy? What is the role of policy development in creating this kind of change? So I'm going to turn it over just to hear a little bit more from my colleague Deirdre Goodrian. This webinar was originally initiated as part of a project that she's been involved with in partnership with the Public Health Agency of Canada, as well as a number of other partners. And I'll turn it over to Deirdre to tell us a little bit about that project and how this webinar came to be. And Deirdre, I'll just pull up your slides as you're talking.
Great, thanks, Stacey. Good morning, everyone, and a warm welcome once again to everyone who's participating in the webinar this morning, and also to my two co-presenters, Melanie and Phil. I'm really thrilled to have both of you on the call this morning. So I thought I'd start out this morning by giving a brief overview of a project we've been working on, which is an innovation project through the Public Health Agency of Canada, and it's called Living Life Fully. In the first phase, we did the project in the Upper Skeena, and that was how Storytellers became involved in the project, and also in Prince George. So just by way of a bit of background, this project was intended to work with young people in the community to address the issue of healthy weights. And I thought I'd start out this morning just giving you a brief overview of the project so you have some context for our future discussions. As most of you know, we've been really consumed with how we can increase our healthcare costs, deal with the demand side of healthcare, and I think this quote is really apt because it really talks about the importance of reducing the need and the demand for care. In other words, putting a focus on health promotion. And so really this project is about swimming upstream in health promotion and looking at alternate ways that we can find to help young people address the issue of healthy weights from a place-based perspective in their communities. So just by way of a synopsis, there are three phases to the project. The first was to have the young people do some asset mapping in their community. And what that meant was for them to sit down and actually talk about the issue of healthy weights and how to create greater health in their communities from the specific context of how they feel within their communities and some of the assets that they feel would work for them in the community. The second phase was for them actually to develop a project. So the picture you see in the middle of the slide there is a group of young people who actually worked together on a healthy baby foods project, and they also put together a traditional cookbook focusing on the Aboriginal diet. And then the third phase was to look at how we could create policy change, and I think that picture is kind of apt that we have dental and confectionery in the same aisle. So as I said earlier, this project is about engaging youth in a by youth, for youth process so that they can address some of the health needs in their community. And they were also supported by adult allies in the community, so they had a team of collaborators who gathered around them to support the work that they did. The work has really focused on all three of these aspects. So the me in the project, we did a really reflective process as part of the project where all of the practitioners, including the young people, participated in reflection on action to increase our reflective skills. We also worked at developing collaboration and increasing the capacity of the team, so that's the us. And as I mentioned earlier, we also worked on some of the systemic influences at play in our communities related to this issue of healthy weights. One of the aspects that we brought to the project is increasing the understanding of youth engagement and how to engage youth effectively in the community. And we looked at the spectrum of youth engagement, but we also looked at the idea of positive youth development, that meaning an opportunity for young people to have a say in what their future looks like and to enhance some of the practices that were going on locally by bringing that perspective to the community and also to some of the policymakers at the local level. So this is just an overview of that spectrum of engagement, working from informing people in the community all the way across to empowering and having youth-driven activities take place in the community. As I mentioned earlier, we worked using a reflective practice, and this was incorporated into our work throughout the project. And really, probably one of the most exciting aspects of the project was that the young people really felt that their sense of agency and ability to have an influence in their community really increased throughout the course of the project. We also used a participatory research process called Photo Voice, and some of you may be familiar with it, but basically it's the idea of telling the story of the project using photographs and asking deeper questions about why some of these things are influencing young people at the community level. So it's also used as a research and inquiry tool. I had the opportunity to visit Hazelton recently, and as many of you know, some of the systemic influences there relate to the Enbridge pipeline and the plans to put that through to the Terrace area. And so there was a group of people from the Gitsan band who had posted some of these signs, and they're participating in what's called a unity group. And I was pleased to hear that recently they came to or they're working toward a peaceful resolution. As you can see, there's a lot of tension in the community about the difference of opinion about some of the changes that are proposed. And then the last slide I want to share is just a slide created by young people, and I think really this is the focus of the project and is to really bring the creativity and innovation that the young people can bring forward to this issue. And so at this point I'd like to turn it back to you, Stacey, and I'm pleased to take any questions if anyone has any.
Great. Thank you so much, Deirdre, for the background on this project and sort of where this webinar has sprung from. I know it's been a fantastic project, and we'll hear more about it from Melanie a little bit later. In addition to partnering with the Public Health Agency of Canada and the Living Life Fully project, we're also really excited that this webinar, we're offering this webinar through a partnership with Healthy Families BC Communities Initiative, which is a new provincial initiative that we've been working with here at BC Healthy Communities. And I think several of you on the line recently participated in some consultations related to that initiative. We've recently just held in collaboration with our health authority colleagues and Ministry of Health colleagues 7 consultations with local governments around the province around this initiative, which really is about looking at opportunities to take a more collaborative approach to building healthier communities and chronic disease prevention at the community level. So we had these 7 consultations with over 200 local government representatives and I think over 110 communities participated in those. What we heard a lot through those sessions was there's a real desire to have more collaboration, which I suspect will be one of the themes we talk about in today's session, but also there was really a desire to have more opportunity for dialogue and learning about how do we create change at the community level. So we saw this as a great opportunity to link with this webinar, given the theme of comprehensive change. And also I think it's a great fit because, interestingly enough, what we heard from many of those local governments is one of the key issues that they're facing are issues around healthy weights in youth, which I know Living Life Fully has focused a lot on. So we're thrilled to have that partnership and make the links with Healthy Families BC, and I know a number of you participated in those sessions and are hoping to build on some of the conversations we had there. So just a bit about how we'll structure today's session. We're going to have our speakers panel where we'll hear from both Dr. Hamlin and Melanie. Each of them will do a presentation of about 15 minutes, and following each of their presentations we'll have a few minutes for any questions you have specifically for each of them about their presentation. And then following that, we'll have an opportunity to have a group discussion. And again, I just want to encourage as much participation as possible, so at any point during the session, if you have any questions or comments, you can feel free to raise your hand using the status icon, or you can just type in using the chat box to let us know if you have a question or a comment for anyone. I always like to start the sessions by getting a sense of who's on the line, and I did have a chance to look at the registration list and know that we have quite a diverse group, and I was really excited to see the diversity of people who are interested in this topic. So I'm going to invite you again to use the set your status icon, which is the little person with their hand up in the top toolbar, right-hand side of your screen there. You use the drop-down menu. And I'll ask you to raise your hand just to let us know who's on the line. So let's, anyone who works with local government, if you could raise your hand. Let's get a sense of how many people here work in some capacity with local government, either as an elected official or staff. We're just getting a quick look here. It looks like we've got about 1, 2, 3, 4, 5, 6 people on the line. Great. And you can just clear your hand there by clicking, I think you click again on the raised hand. Great. How about community-based organizations or non-governmental organizations? How many folks on the line work at that community level or NGO level? Lots of hands going up. Just take a minute to count up. We've got 1, 2, 3, 4, 5, 6, 7, 8, 9. Looks like about 9 people. Fantastic. Again, you can just clear by clicking on raise your hand again. I think there's quite a few people that work in the health sector, either with health authorities or as health professionals. So again, I'll invite you to raise your hand if you work in the health sector. Fantastic. So it looks lots of people working in health. So obviously today's session has a lot to do with health. We've got 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 people who work in the health sector. And again, just you can clear your hands. And what about folks who work at other levels of government, either provincial or federal government? Got a lonely person there with provincial and federal government. Glad you're on the call. Thank you. And I know also a few people are here as concerned citizens or community activists. Probably some of you who are here in your professional role may also be here as concerned citizens, so you can raise your hand if that applies to you. Yeah, lots of folks. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Oh, the hands keep going up. I guess we're all concerned citizens at some level. Fantastic. Thanks so much. As I said, I'm really excited about today's discussion because of the diversity of folks on the call. You can just clear your hands by hitting the raise your hand icon again. But I think we can have some really interesting discussions about the role of working together and working collaboratively across sectors in order to create the kind of change that we're talking about. So I'm going to turn the session over now to Dr. Phil Hamlin. I'm just going to pull up Phil's presentation here to get that lined up. It'll take a minute to load. And Phil, we're just, as I said earlier, we're so thrilled that you were willing to come back and share more about the work you've been doing with the After Now project and the work you've been doing in Scotland. I certainly took a lot away from our last call. It left me a lot to think about how do we create the kind of change that we want to see within the public health sector and what's needed to create that. So I'll turn it over to you. And again, remind everyone if you have any questions or comments throughout, you can use the chat box and we'll have some time afterwards for questions and answers.
Thank you very much, and a real pleasure to be with you all. And it's interesting when you identified yourselves. I'm a doctor by background, and I got interested in public health in the 1980s when I was working in West Africa in the Gambia. And that was when something which the World Health Organization had initiated, which was then called Health for All by the year 2000, which basically was where many of these ideas of community development, of empowerment, of cooperation, of healthy public policy came together. And so it's wonderful to see an example of that in Canada. And I know that that whole idea has spread throughout the world, and that it had its origins often in some of the poorest parts of the world, and now has found its application in places like the UK and North America. I worked then for a while in Glasgow in health promotion, and it's interesting that we should be, and we will be focusing on weight and obesity and healthy eating. And I remember in 1984 we set a target for the reduction in obesity, and we abandoned that target when it was clear that none of the trends were going in the right way. And I don't know if your government does the same, but we only keep targets that we look like we're going to meet, and that may be overly cynical. But the point I want to come back to on that is that it was over time working in public health that I realized that we faced a whole series of intractable problems, and I'll try and explain why I think they are intractable. And it was out of that frustration with some of the conventional approaches that we'd been taking that this project that is spoken of in the first slide, this After Now project, was born. And you'll see there the website, and if you find anything of interest in what I have to say, then you'll find much more about the project and the thinking behind it on the website. So that may be of some interest to you. I'd also like to commend to you something that you can Google. If you Google this guy's name, Hans Rosling, or you simply put in the joy of stats, you'll find a little 4-minute presentation from a longer program that he made for BBC. And what he does is he takes 200 countries over 200 years and in 4 minutes charts how they moved from being basically poor and unhealthy to become, many of them, rich and healthy. And of course the United Kingdom and Canada have been part of that process, and more recently countries like Brazil and China have been moving rapidly in the same trajectory. And of course that gives rise to certain inequalities and other problems which he doesn't go into. But the point I want to draw from this is that we need to think, and I want to just spend a moment or two to think about how a developed country like the United Kingdom did move from the early industrial period when it was relatively poor with very low life expectancy of just above 30 for most people, to our current circumstance. And in that analysis, I think we may learn something about public policy for improved health today. So if we go back to 1830, and we say, what was the first wave? Well, one of the important things, and I think this is very relevant to our current circumstances, is if you went back to 1830 in Glasgow or any European city, you would find no public health professionals. They hadn't been invented yet. What there was chaos. Literally. I mean, if you've seen the film Gangs of New York, you'll see that there was violence on the street. You know from the cholera epidemics that we couldn't keep feces out of drinking water. We know that people were exploited in factories and had very unsafe working and living conditions. And as a consequence, health was just terrible. To take just 3 indices, violence, illegitimacy, and alcohol consumption, they were all much worse in industrializing cities in North America and Europe in 1830 than almost anywhere we have in those continents today. We need to go to some of the poorest parts of the world to see something comparable. So what began to make a change? And the answer is both bottom-up and top-down interventions working together. If I take my own city of Glasgow, we created a safe water supply from a loch north of the city. And we created the Victorian sewers that we still use today. But at the same time, shopkeepers would police the area outside their shops and make it safer. People worked together to start to build a modern industrial city with all the facilities we now enjoy. The city authorities appointed the first medical officer of health. So things were happening at all levels. And it may be that we need to discover some of that approach as we confront some of our intractable problems today. The second wave, though, from the end of the 19th and into the first half of the 20th century was when life expectancy really started to improve. Infants benefited from safer water and from some of the things that began to happen in the earlier part of industrialization. But it was in this period that we began to see the modern world emerge, and with it all the benefits that come from it. Now, in a moment or two, I'm going to say some things that question how successful modernity has been. But if you ask yourself, what has modernity brought us? It's brought us a great deal. And it's not just in the area of health, but education, of comfort, of manufacturing, of wealth, of choice, of travel. And it was really in that period that these things emerged. I mean, my metaphor for this is anesthetic dentistry. You know, if you ask yourself, what has modernity done for us? The fact that we can have teeth that can be looked after without all the pain that went with it before is a symbol of all that period brought. And life expectancy improved dramatically during this period, but inequality did not. And so for Europe, and particularly for the United Kingdom, but I'm sure also for North America, this period of the post-war reconstruction was when welfare and inequalities were being addressed. And for Britain, that was a national health service, comprehensive education, state housing, and all sorts of public policy interventions which were designed to bring the benefits of prosperity to the whole population. And indeed, there's a lot of evidence that during that period of several decades after the Second World War, the state in Europe and in North America succeeded in large measure in doing so. And we saw life expectancy and other health indicators improve accordingly. However, that period came to an end and inequalities began to increase. But nonetheless, life expectancy has still been climbing, and that's what we're calling here the fourth wave. And basically, most of us are now working in fourth wave activity. And the fourth wave, in terms of public health, has been about effective health care and interventions that prolong life by addressing risk, things like smoking, diet, alcohol, sexual activity, and so on. And so what we've learned to do is take people who previously would have died of chronic disease and or contracted chronic disease and died from it because of risk factors, and manage that risk, but also allowed them to prolong their lives, a tremendous thing, I should say, with chronic disease. So some cancers, for instance, which would have been rapidly fatal as recently as 20 or 30 years ago, can now be managed for literally decades. And we've managed to control heart disease survival in an extraordinary way. And so while it was true that in the early waves, it was younger people who benefited from our interventions, in this latter period, it has been the ability to allow older people to live longer that has allowed many of the health indices to improve. And the argument I want to make from this is that if you ask the question, what do we need to continue to do? The answer is all four of those waves. We still need to be ensuring environmental safety, safe water, healthy working environments, and so on and so forth. However, our marginal return on investment in those areas is now relatively small. We won't get the big improvement that we saw at first. So it's like the trough of a wave running on into the current time, but still needing our attention. We still need to ensure that the benefits of prosperity and of scientific advance are brought to people and continue to enhance their lives. We still need to work in the welfare state. But you know, in my city, I could point you to houses that have been rebuilt 3 times since the Second World War, and it's unconvincing that simply building infrastructure, simply using the resources of the state to provide goods and services is going to bring the kind of benefit that these things were felt to create when they happened just after the Second World War. We need to continue with the management of risk, and of course there are risks for obesity that we have already touched on in this webinar. And we need to continue to help people to live healthy even with disease. And that is an agenda still with a lot of work in it, and is still part of our public health agenda. So what is our policy challenge? It is to keep these 4 waves going and going well. However, it doesn't take much imagination to recognize that in all of those areas that I gave examples here of the waves that need to continue, we get some resistance. I don't know what you find in Canada, but here, when the latest vaccine comes along, it doesn't get greeted with enthusiasm in the way that the first smallpox vaccine did. Rather, it's treated with suspicion, even controversy. Equally so, regeneration can be controversial and difficult. And chronic disease management is an area of debate and particularly a concern by policymakers about the amount of resource that's going to be needed to continue all of that. And I would also argue that the 2 big approaches that I've been engaged in my public health career, the first of them, Health for All, which drew ideas from all of the waves, has largely been superseded by a much more reductionist, scientifically orientated, evidence-based public health. Now, I don't think many of the participants today would be heavily towards that side of things, but in much of North America and Europe, it's become very narrow in its focus and very dependent on quite a narrow approach to science. And I would raise that as a concern. But my biggest concern, and the issue I want to focus on, is this, is that we have a set of issues which we don't basically have solutions to. There isn't a country in the world that has yet reversed its obesity epidemic. The obesity epidemic began in the 80s across the developed world. For the whole of human history, we've largely managed to avoid an obesity epidemic, even though we are obesogenic organisms. Those of our forefathers who, instead of eating greedily from the antelope that had been slaughtered, declined and decided to eat berries that night, those ancestors died and didn't give rise to the progeny from which we flow. So we are prone to eat, and we're prone to conserve energy. But in the 80s and 90s, and since then, we've inhabited obesogenic environments that has made obesity hard to avoid. In short, obesity is a product of late modernity itself. This is also true of addictive behaviors. It's also true of the loss of well-being that we observe, and it's also true of the demographic changes. And therefore, it seems to me logical to say that if we continue to live the way that we do in the paradigm that informs the living in the way that we do, these problems are going to continue. Of course we can do things to soften them. Of course we can help individuals, and we should continue to do that. Of course we can build on the success that we have, for example, had with tobacco and try and apply it to alcohol and the determinants of obesity. But at the moment, it seems unlikely that we'll reverse these problems unless we change the conditions that created them. And that was the key insight that our After Now project came to. Now, that might be a depressing conclusion to come to, but it's not in its way depressing. It's really just part of a further bigger picture. And that bigger picture I touched on in the last webinar, which is that modernity itself is in crisis. It's in crisis culturally because it's in this vortex of materialism and individualism and consumerism, and that is eroding our well-being. It's subject to these diseases of modernity like obesity and loss of well-being. It is absolutely controlled by a mindset that makes money and economism, the financial bottom line, as the determining factor in almost all decision-making, both in the public as well as the private sector. And it's powered by a belief in progress and a belief in the absolute need for growth. And that's simply not sustainable. It's not sustainable economically, it's not sustainable environmentally, it's not sustainable socially. And when we first started this work, I imagined that what we were searching for was the next wave, the fifth wave, if you will, of public health intervention, a new approach to policy that would build on, transcend, but include these four previous waves, and so we would have 5 waves flowing on and finding solutions to these problems. However, the more we looked at it, it became clear to us that this process that began with the Enlightenment, took off with the Industrial Revolution, gave us such benefits, but is now subject to diminishing returns. The whole idea of modernity is probably now peaked and moved into decline. And so what we're looking for is something much more radical. A new inner world and a new outer world, a new mindset, a new paradigm, which allows us to move beyond the assumptions that have pushed us into crisis, into unsustainability, and into the diseases of modernity. So what are the implications there for policy? Well, I've divided them into two parts. First of all, work still needs to be done in the previous four waves. We still need to maintain the welfare state. We need to look after the vulnerable in society. We need to manage chronic disease, keep the water safe, and all of that. In short, we need to keep the lights on. And there's much work still to be done on that. However, at the same time, forgive me for changing the metaphor, but at the same time, we need to learn the skill of how to redesign the aircraft while it's still flying. While we're still keeping the lights on, keeping all that old work going, we need to be inventing something new. And we need to be aware that public health, even health for all in the more progressive and community and person-orientated aspects of public health, is the child of modernity and may need to challenge itself to move beyond. And so the policy challenge is to think about other world views and whether they would be possible, and to move into new ways of thinking, being, and doing. And that's why I think the link between community engagement and involvement, because our experience is that the most innovative work is being done at small scale and on the ground by people who are concerned by the big picture, but finding ways of responding to it in their local lives and in their personal interactions. The last time I spoke, I mentioned Plato's idea of integrating the true, the good, and the beautiful. One of the reasons we've got ourselves into the problems in modernity that we have is that we've allowed science to dominate our sense of morality and ethics, as well as our sense of aesthetics. And by art and the beautiful, I mean those things that fire our imagination and lift our consciousness and make the vision of something new and different possible. And we recognize that in our lives we naturally, or Plato did and each of us do, we naturally integrate what's true, good, and beautiful. And public health needs to do the same thing. Public health policy needs to do the same thing. So we don't need to ask what's the evidence-based, where's the randomized trial, but we need to think about whether or not this is an ethical and good thing to do, but also is it something that will engage us, engage our spirits, fire our imaginations, and cause us to think differently. And we've developed this simple model of the conventional and the ecological science, the conventional and ecological ethics, and the conventional and ecological aesthetics. And you can take that simple model and apply it to something like food. And so if you look at public health guidelines up until now, you'll find evidence-based protocols on how to prevent heart disease and minimize obesity. And of course, we need these. But we need to think about them within systems theory and the whole human and social and ecological ecosystem that supports the production and the distribution of food. But we also need to think about the justice of access to food in a global sense and the need to confront malnutrition and undernutrition as well as obesity and other aspects of food-related health. We need to think about sustainability, balancing health and costs, and thinking about waste. I don't know about your country, but I've got data which suggests that almost half of all the food that's bought in Scotland is thrown away. And that surely is not sustainable, but neither is it ethical. But it's actually the more aesthetic side that maintains and develops our capacity to change. And so I don't know if you're aware of something called the slow food movement, but it's about trying to rediscover the joy of slowly preparing, consuming food, and enjoying the fellowship that that brings. Seasonality and consuming locally produced food is also part of experiments that are happening at the local level. But this all points to the need for a mindset change, which results in a different relationship with food, a different awareness of it, and a different orientation. And that's what I sensed in the first presentation we were trying to draw out of these engagements with young people. So the issue is obesity, but it's much more than that. It's actually how do we develop a whole different relationship with our lives, our future, and thus our food. And I think if we did that, the obesity epidemic would wane. And if we are not able to move across and take action in all 6 spheres, it's unlikely that we'll do so by concentrating simply in one. I finish with a little plug for a book we've just published called The Future of Public Health, and it sets out some of these arguments and gives some examples of inspiring people, organizations, initiatives, and projects which are beginning to pioneer this 5th wave. Thank you very much indeed.
Thank you so much, Phil. We have a couple of minutes if people have any questions or comments specifically for Phil regarding his presentation. So again, just a reminder that you can use the chat box to type in any questions or comments, or just use the icon to raise your hand to let me know if you have a question, and yeah, you can put it forward verbally. Phil, so interesting. I find this so provocative, and I'm wondering, knowing that we have a number of people on the line who are policymakers or trying to influence policy, I'm wondering if you can speak a little bit more about the role of the good and the beautiful in our work on policy development. I mean, what I heard from you speaking is that we focused a lot on the true. Maybe we're a little bit out of balance in these other realms. What does that mean for policy development?
Well, I think the truth of the matter is that people will only engage in something if it really does speak to them, if it engages their inner life, their sense of who they are as a person, how they want the world to be, and how they relate to other people. I think we know that anyway. That's why I say that we naturally integrate the true, the good, and the beautiful in our lives. But in policy, that's quite difficult. And policymakers have become obsessed with evidence-based policymaking. So my feeling about this is that if we've to develop an alternative to the food economy, which is dominated by supermarkets, by profit margins, by waste, by food miles, and so on, we'll need to have an approach to food that people really love, that they really enjoy, that they really engage with, that nourishes them physically, spiritually even. And the kind of projects that I'm aware of locally that are doing that, for instance, is something called the Fife Diet. And these are people who produce entirely locally for local consumption and create recipes which they can be easily cooked by people and inexpensively consumed, but give joy back to the whole process of food production and consumption. And it's really taken off. It's not large scale yet, but the reason that it really works for the group of people who are engaged in it is that they just love being part of this whole approach to producing and eating food. So that's what I mean by the beautiful.
Yeah, and I think in food that's really evident. I'm just looking at some of the questions coming in. I know a number of people are busy typing. There's lots of questions being fueled here. There's one question about climate change, and how does this fit with what you're talking about? Yeah,
I think, first of all, climate change is one of the key evidences for unsustainability. And therefore, it's one of the key bricks in the wall of this argument. We're going to have to change whether we want to or not. We're not going to change to make ourselves avoid the obesity epidemic, but climate change and or peak oil and or the debt crisis is going to force quite profound change in our society. So if change is inevitable, those of us who care about the health and well-being of our communities will want that change to be positive, to be equitable, and to be inspiring. The world adapted to climate change could be a much better place. And it could inspire us and raise our spirits and raise our consciousness. So that's what I mean about the beautiful. At the moment, part of the problem is that what we say is climate change is a terrible threat and we're going to have to give up lots of things if we respond. I would prefer us to say, how could we make life better but also sustainable and healthy? And it's that way of thinking about the discourse and about the policy that might draw us into a different approach to all of this.
Thank you. There's a question here about the paradigm shift that you're talking about, and particularly in your experience, Phil. Can you speak about how you work to support this kind of paradigm shift, and particularly who have been your allies? Who are the players that need to be involved?
The paradigm shift is emergent, and I don't possess it, and I don't know anyone who does. But I do know that there are literally, and I had the pleasure of visiting Vancouver in 2010, and I met lots of people there who are talking exactly about all of this. And all over Scotland and Europe, I meet people who have basically come to the conclusion that the business as usual is not sustainable, and we need to start living and working in a different way. And they're inventing this new paradigm shift as we speak. But I don't think anyone has captured it or got it, if I can put it that way. So what we see is bottom up and top down. So if you talk about big policies, I mean, there are people talking about carbon rations, for example. Now, if you think about that, if every time you used your credit card, it took money out your bank account, but also out your carbon account, and everyone had the same level of carbon, think what that would do for inequalities. Think what that would do for our sense of mutuality, the sense in which we are indeed responsible for our consumption choices to each other. Now, I don't know, I don't think we're close to that yet, but I think that a discussion about that type of policy intervention would open people's eyes to the type of change which might yet be necessary to confront climate change, but also could make the world a better place because it opens up a different way of living and makes it more equitable.
Mm-hmm. Lots more questions coming in. I'll take just a couple more, and then I think we'll wrap up this conversation right now, knowing that we have some time at the end following Melanie's presentation to have a group discussion for both presenters. Therese has a question about the 4 waves in relation to some of the complex issues that we see here in Canada with our First Nations communities. And Phil, that's a little unfair knowing that you're not in Canada, but wondering if you have a sense of some of the complex issues that our First Nations are dealing with and how this would fit in that context.
Yeah, when I was in Vancouver, I met a gentleman called Bruce Alexander, and I asked to meet him because I'd read his book, which is called The Globalization of Addiction. And I shared with him some of the data from the poorest communities in Glasgow. And his comment was that it was very, very similar to the health outcomes observed amongst the First Nation communities in Canada. So that's about as much as I know. But what I think both of these communities, if that observation is true, share is that the benefits of modernity started running out for these communities a long time ago. So in Glasgow, there are communities that deindustrialized in the 1970s, and there are people who haven't been in work for now 3 generations. For your First Nations communities, modernity came along and destroyed their previous way of life and hasn't truly allowed it to emerge. But what I hear from places like Alaska is that there is emerging a movement amongst First Nations peoples, particularly around health, which seeks to use story and other interpersonal approaches to heal some of the wounds of the past and develop an approach to health which is truly holistic and is grounded in their culture and allows them to transcend even these assaults and insults that have hit them. And in a way, some of the people in Glasgow have become really interested in that, and they've been traveling to Alaska to see how that's done, to see if you can bring back to the poorest parts of Glasgow some of the insights that have been developed there. Now, I don't know if you've anything analogous in British Columbia, but what I would say is that there is something to learn from communities which have either been damaged by modernity or have, for a longer time, seen the malign effects of it. Because if the predictions of peak oil, climate change, and so on are accurate, most of the rest of us are going to have to learn how to make that transition sooner or later.
Thank you. I see, Kate, that you have your hand up. Do you have a question you'd like to ask? And if so, just a reminder, you can press *6 to unmute. Okay. So just looking at some of the comments and questions in the chat box. So there's a comment and a question here. Good and beautiful for policy making. How about a framework for qualitatively measuring where the people's inner desires are going? For example, the growth and popularity of farmers markets here. It seems there's a lot of energy here, and how do we measure this new interest in qualitative ways for policymakers? Any thoughts about that, Phil?
Yeah, I mean, I think we've got a wee rubric which says, you know, the future public health will be, and there's 4 or 5 characteristics, and one of them is integral. So it will integrate the inner and the outer. It will integrate the quantitative and the qualitative. It will integrate the objective and the subjective. One of the unbalancing things of late modernity is that it's separated these things. So yeah, we will need a framework for assessing, for understanding and learning that integrates the best of objective reductionist science with qualitative, subjective, experiential inputs, which are equally valid. One doesn't trump the other. They're simply part of a wider, more integral framework for assessing things.
So here's a comment about modernity. Modernity is just a fact of life in the era we live in. Factorization of food, processed food, canned food, etc. is here to stay. It would be great if everybody could grow their own organic food, but we all know that's not practical in the modern industrial cities we live in. Your analysis is right on, but my question is, why can't we all get the foods that we buy at the grocery stores why can't we get the foods that we buy at the grocery stores? And sorry, I've lost my track here. And fast food restaurants to submit some stringent government standards. Why can't we get the food?
Okay. No, I mean, that's a good question, and I don't pretend to have a simple answer to that. I think that kind of expression is at the heart of the debate. So the first point to make is I'm not saying that we can go back to some pre-industrial past. That's clearly impossible, and I'm not suggesting that for a moment. And that's why I said that we need to use all the great benefits of modernity. Modernity is also a fact of life, but the point I would make is that it doesn't stop there. If you go back to the pre-modern period, I think I mentioned this the last time, but let me briefly mention it. I went through the Pyrenees last summer, and there was a valley where they spoke a slightly different Basque dialect from the next Basque valley, and they used to have a war every summer when the snows melted. Now, if you went back in your time machine and you said to these people, look, there will be a day when you'll all be something called French, you all speak the same language, and you'll voluntarily pay taxes so that not just people in the next valley, but people literally hundreds of miles away can benefit from a shared sense of being part of a nation. They would think you crazy. Yeah, they would say that's impossible. That's not what reality is. But of course, that's what happened. And equally so, if I say to you, we look forward to a time when we do have a global consciousness, when the issue of healthy, sustainable food just as a natural way to live, and yes, we'll use industrial means of production and distribution, but we won't allow the profit motive and the unhealthy dimensions that have characterized this era of history to so dominate. You might say that's utopian, that will never happen, that's not reality, but the analysis of history is that human beings are capable of moving into new ways of thinking, being and doing, and allowing that to happen. And so what I'm suggesting is we need to build on the examples of those people who have that vision, have that sense of what's beautiful and possible, and nudge it with the policies that do so. Don't pretend we have the answers, but be very confident that that's the direction of travel that we want to go in.
Fantastic. I'm going to stop us there. Thank you so much, Phil, and thank you everyone on the line for the questions. I know there are a few more questions, and I'm going to suggest that we come back to them at the end in our group discussion. And Phil, if you would like to also add any comments using the chat box for a couple of the questions that are there, please feel free. A big thank you to you. I want to make sure we have time to hear from Melanie, because I know from my experience watching the work of storytellers and working a little bit with storytellers, that the work that they do on the ground really does integrate these three aspects of the true, the good, and the beautiful. So Melanie, I'm going to turn it over to you to talk more about the work that you've been doing with the Living Life Fully project. And it'd be great to hear if you see any links with the conversation we've been having with Phil.
Absolutely. Thanks, Stacey. Hi, everyone. It's very odd to be speaking into an empty screen, but I'm looking through the list, and there's a lot of colleagues and friends that are on the line, so it's great to see you're on there, too. And I'm coming at this with a bit of a caveat. I've been working with storytellers for 11 years, but I've been away since January doing schooling, and so my comments are coming out of experience that feels like it's a little while ago, so I'll try to be as focused as I can. Lots of questions and comments from what Phil said that I think will be relevant to what we're going to talk about. But just to make really clear, our example is really based in a context, and I'm hoping what will come from my comments that I'm sharing is that it will bring up questions about your own context, because the storyteller's work is very based in a northern, remote, rural, Aboriginal context, and I'm hoping that that will more spark questions about how could this raise some questions for how to link that to your own practice, wherever that is. Also, I'm not an expert, I'm just sharing my experiences and our learning on the ground, and I'm hoping that that will be valuable for this conversation. So without any other comments to lay before the community context, I just want to set up really quickly. Hazelton is part of the Upper Skeena region in northwestern British Columbia, for those of you who don't know Hazelton. And I think that context is really critical for the Living Life Fully project and storytellers' work in general. Youth that mainly this project has been working with, mainly youth, are growing up with some of the most challenging social and economic realities in BC, and the comments around First Nations, there are very complex issues in Hazelton that I think resonate with other northern communities, and I think definitely will resonate with that discussion as well. About 3 years ago, there was a lot of media coverage in Hazelton around an epidemic, a suicide epidemic it was being called, with youth in the Hazeltons, and this is just one of the many articles that was written on in the Tyee, in the Vancouver Sun, in the CBC radio picked it up, and there was just a cry out to the province and the rest of the country, the federal government, to work alongside communities on the ground, because youth were really struggling with the realities that they were growing up in. And some of those realities, and some may have seen this slide before, this is just sort of summarizes some stats. First, to just give a brief snapshot, the youth population in Hazelton is extremely high compared to the rest of the province. About 60% of our population is under 30. The unemployment rate is again pretty standard for smaller northern communities who are struggling with sort of the boom and bust economies, but also sort of the fallout from colonization, which we've talked about a little bit already. Some of the smaller communities in the Upper Skeena region are upwards of 90% unemployment, and so kind of with an overall average about 67%. And you can just look at some of the other stats that I think inform our conversation here. You know, housing in need of major repair. The infant deaths per 1,000 live births is about 35% higher than the BC average. Death from medically treatable diseases is about 4 times as likely, and alcohol-related deaths about 2 times as likely. So this is the sort of the context that we started the Living Life Fully project, and trying to look specifically at, I mean, the project was looking at healthy body weights with youth, but we knew that we were looking at a much bigger journey at trying to look at try to create healthy conditions for healthy body weights, and also just healthy living in general. So Storytellers Foundation, Storytellers has been working in the Hazelton region for about 20 years now, and we use a community economic development approach. So I saw that one of our hosts here is the CED network in Canada, and I think that's critical for our discussion because of a lot of what Phil said, that we need to find new ways of thinking and being. And CED is a way to include people that are most affected by the issues in finding ways to improve their lives and take control of their future. And it's not just looking at just health or just the environment or just the economy, but trying to link all of those in sort of a triple bottom line lens to look at sort of the whole picture of a community. So our Living Life Fully project was embedded in that CED frame, and the project supported youth in particular to, as Deirdre talked about, do some asset mapping and start to take some action around those issues that affect their health. So I won't go into too much detail. I don't have a ton of pictures to show you, but really quickly, the way we approached it in Hazleton, because there were other groups that also took on this project, was we supported youth specifically. We had some peer educators involved as well, but mainly youth that we would say are sort of at the margins. So those that were sort of struggling the most with some of the issues that I talked about, supporting them to take action around health issues that most affect them. And how we did that was we used a peer educator model. So we hired and mentored young leaders to work with the youth, and then we had adult allies working with the peer educators. And what they did is they engaged youth in, as Deirdre talked about, an asset mapping project that took them in a lot of different directions in terms of action. I'll talk about the action in a second, but one of the things that we did as the peer educators were working in the schools and working in communities with other youth, we took time to track the learning and the observations on the ground through an action research process. And we used the integral frame, BC Healthy Communities integral frame for that. And I'll show some examples of that in a second. The outcome of that was to share our learning with local decision makers. And specifically, we wanted that to shift and give space for policymakers to be able to hear what was happening on the ground so that it could shift policy that was helping to create those conditions in the first place. I think that we're just starting that process, and I'll talk a little bit more about that in a second. But sort of the last piece of our approach was then to not just work with youth, but to involve those that were around youth, educators, decision makers in local government, and also the institutions like the school and the hospitals, to collectively look at policies that were affecting sort of what was happening on the ground. So really quickly, in terms of some of the actions, so you get a bit of a sense, Storytellers has a number of tools that we've been using over the years, and one of them that came out of sort of asset mapping was the need to involve youth in working directly to change conditions collectively on the ground. So we have what's called a toolkit called Making the Rules, and Making the Rules is a small curriculum that you can lead a group through in a series of weeks, and it's a mini asset mapping and action process. And this we decided to adapt because really what we realized was the majority of youth in Hazleton are struggling with sort of that bigger process of even knowing how to take control of an issue and being able to have some personal agency and be able to feel confident and have the skills to be able to take control of their own lives. So the curriculum was designed to, in a very short, small space, to give youth the opportunity to experience that feeling of being able to look at an issue, talk about it, and collectively work on something. So I just wanted to give a quick example of that. These are just examples of sort of some team building stuff. But one of the examples was in an asset mapping process recently, because there's been a number of them that have been done. Youth talked about places where they feel safest or most in control. And one of the places in our community that came up was the skate bike park, which was designed and created by youth through fundraising, designing, building. And so youth talked about that being a place that they felt they owned and they had ownership around in New Hazleton. But they were noticing that they were feeling like the place was run down. And because it's a place where they feel they already have a lot of agency, they talked about, well, how can we make that space feel healthier? And so through conversation with the youth that use the skate bike park, they began to work with local government to replace the signs, to clean up the graffiti, and to actually make that space a space where they felt healthier and they could, like I said, have more control. And so that became almost an example then of how can we work with those that affect things at a policy level, but also how can we be engaged in the conversation of shaping and affecting the spaces where we inhabit and where we're a part of. So that's one piece, and I'll talk about that a little more. Another action is the Healthy Living Clubs, and what we did there was just very simply to start talking about health in fun ways over lunch hour, invite kids in, give them a healthy lunch, and then through activities and similar sort of engagement processes, invite youth to just start shaping and framing how they think about healthy living. And that has been one of the most successful things because kids just love to show up and hang out with our peer educators who are sort of former grads from the high school. Another one, and I'll talk about the YouthWorks Kitchen a little bit later, but the YouthWorks Kitchen slide I have up is actually more of an example of how we've started to work with local government and governance. Storytellers has a social enterprise built into our organization, and what it is a youth catering business where largely at-risk youth are invited in they're hired to be part of the social enterprise and catering, doing catering gigs, but they're also supported to talk through sort of what are barriers for them to be able to take control of their life. So while they're working and creating an incredibly valuable product for the community, they're also getting space to be supported to take steps towards their own dreams and goals. And one of the things Storytellers, YouthWorks is doing right now is providing sandwiches for our local gas bar. So the gas bar being a place where a lot of people, including kids from the high school, walk down at lunch, get something that up to this point has really only been hot dogs, potato chips, those nachos with that horrible sauce. But YouthWorks is now bringing in as much as possible local products through sandwiches that are made by local youth. And so part of that process has been to engage the high school and the local governments and the band office who runs the gas bar to start having conversations about how do we have healthier options in those high busy areas where people are all the time, so that food is more accessible. And while we're actually showing and doing something in a really tangible way through the sandwiches and the social enterprise, we're also sitting down with one of the band counselors, the manager of the gas bar, the mayor of Hazelton, the high school, and the woman who runs the cafeteria at the high school to have conversations about how can we balance those options so that there's always healthy options across all of the walkable areas that youth can hit at a lunch hour, at a given lunch hour. So I'll talk about that a little bit more later because there continue to be contradictions where we still have, healthy options available. The Coke products are sitting right next door. So how do we start to at least look at the range of options that are available and start to support local government to see they have a role in affecting what is on hand for young people within walking distance of the school. This is just an example of the integral frame. I won't go into it too much, but while we've been doing the actions I just talked about, the peer educators are coming back and they're dumping sort of learning questions, things they're hearing from youth, so that we start to collect and start to see what it is that we're hearing from youth along the way. A lot of the data then has been started to be shifted into what are some guidelines that can come from that, or at least if we're not at the place of talking about guidelines, what are some of the recurring themes or questions that are coming up. And this is just an example of people sitting together and talking about and starting to find sort of what are we learning and where do we move that to a policy level. So really quick, I'm aware of time. Some of the things we've learned is, of course, there's a variety of themes that have emerged around youth and barriers to healthy living. Obviously, lack of access to healthy options has come up over and over again. Convenience continues to be a big issue with youth and taste preference. Lack of food preparation skills, stigma attached to eating sort of homemade, or salmon being the thing that everybody can bring to school, but there's still stigma attached to having something that is a local product that we should be valuing and validating and almost rethinking to say this is what the rest of the world is looking for, is local products like this. Or also just the cafeteria is not necessarily a place a lot of youth feel welcome. There's bullying in the cafeteria. There's a culture of food. So there's a lot of issues that I don't want to get into too much there, but themes that we've started to delve deeper into. And the second point there is we've pulled back and started to have deeper conversations. We've realized that the actual deepest barrier is poverty is the biggest barrier to eating healthy for young people in our school, which is enormous. And how do we tackle that? Going to the question we've been talking about a little bit today, we've talked a lot about resiliency in these times where conditions are no longer predictable. I think Phil said it really well, that communities like Hazelton have already seen the fallout of modernity and are already needing to be creative and adaptable to face the current challenges in health. And what we found is with youth, for example, who are struggling with the kinds of things that we were just talking about, we need to be fostering that resiliency at a really deep level to deal with the shocks and traumas that will be continuing for them beyond sort of the scope of a project. So really quick, the challenges we're looking at is how to link what we're hearing, that personal experience, which is all those barriers I just talked about, to the policy level. So for the individual, how do we continue to foster hope and resiliency among those that are most marginalized, so like YouthWorks? At the infrastructure level, how do we ensure that youth have access? And that's just a really basic one, but it's full of its own complexities, like I just talked about. Everyone needs to see that they have a role. Some of the local government, the elected officials already see they have a role, but there's many who don't see that that's within the scope of what they're doing. And institutions like the hospital and the high school, we have a couple of champions who are on board, but it's still hard to bring that to the consciousness of the rest of the boards that they're sitting on, or the rest of those that are in decision-making positions. And finally, how do we support local governments to see that they not only have a role, but a responsibility? And I think in our community, we've seen, again, a fallout from colonization is that decisions tend to be made far away from those that are most affected. So in Victoria, in Terrace, in Ottawa. And so decisions on the ground in Hazelton need to be involving those that are most affected. And finally, what are our hopes to start bringing all of these pieces together? I think we've learned a ton, and it's starting to make those links and figuring out how to actually take what we're hearing and get it to the right places so that those who are making decisions are actually able to make shifts and changes around guidelines. Continued focus on building resilience in addition to those really practical changes I talked about access. And finally, bringing our community government structures together. There's so many willing people, but how do you make it manageable so busy people can actually sink their teeth into something and make it a really tangible policy change that they can make at their decision-making level that'll make a difference on the ground. And I just want to give a very quick example of pulling the pieces together before I wrap up. In a recent conference in Hazelton on poverty and racism, one of the young women that's been working in YouthWorks for a long time paired up with our local MLA to present together on how to tackle poverty. And she shared, as a young woman who's had a lot of barriers in her life, she shared sort of her own experience of living and living in poverty and trying to exit poverty. And she was really clear. She says, I have what I need through sort of especially my contact with family and YouthWorks. I'm supported, I feel loved, I have food on my table, my bills are paid, I have a bit of savings. There's no violence in my life. There's very little influence of alcohol anymore. I have an identity because I can access the land base, which I think is really important. But having that conversation, be able to share her story, sitting right next to her is our MLA, who I have to say, in all honesty, we're very lucky because our MLA used to work for storytellers. But he can make direct links to what she's saying to policy. So to saying, this young woman who's able to find a spiritual connection and a sense of identity because of access to her land base, her traditional territory, we need to have environmental policies that are going to continue to protect that. So what Deirdre talked about the Northern Gateway pipeline, is it has direct relationship to a young person's experience on the ground of wanting to be resilient and having hope. Again, another policy change, she talked very honestly about her sort of efforts to try to exit poverty, but that the policies around welfare don't allow her to even look at trying to own a house while being on the welfare. So our MLA can start to look at, well, how do we shift policies so that we can support someone who honestly wants to work towards having more self-sufficiency to be supported at a policy level to do that. That's just an example. It's probably a pretty unusual and beautiful example of how those who are most affected by an issue can be touched and work alongside a policymaker. But I think that we could all find creative ways of getting the right people to connect and have the examples on the ground to connect with those who can make a change at the policy level. So I'm sure there's lots more I could say, but I just want to open it up for questions.
Thank you so much, Melanie. We do have time for a couple of quick questions directly for Melanie, if there are any questions or comments related to her presentation, and then we'll be opening up for a broader discussion with the whole group and with both Phil and Melanie. Maybe just to kick us off, Melanie, you mentioned a few times throughout your presentation this idea of resilience or resiliency. And I'm wondering if you can speak to that a bit more and what that means to you, in this work, and how does it play into our work to try and create this more comprehensive change?
Yeah, I think the word resiliency can be both, and I'm sure there's others on the call that know a lot more than I do, but how we would talk about resiliency at Storytellers is the ability to bounce back from shocks and traumas in our lives. So having the skills, the knowledge, and the confidence to be able to bounce back from adversity. And at the individual level, I think a lot of the story I talked about is meeting people one-on-one, meeting them where they are, giving opportunities to engage and build that skills, knowledge, confidence in a really supported setting. but I think communities as a whole need to build that resilience as well. And that system of a community is a lot more complex to do it. But I think we can build the skills in the same way that I'm talking about sort of at an individual level. It starts with saying, what are our assets for being able to bounce back collectively together? How, I think some of the things Phil talked about, how adaptable, how flexible, how creative are we already, and where can we start to work towards doing that at a community level more effectively? And I'm sure we could talk about that at institutions level too, but those are the two I'm most familiar with.
Yeah. I see that people are typing some questions, so while those are being input, I know you spoke about this in that beautiful example as well of the young woman who shared her story alongside the policymaker. But one of the things that's always struck me about the work that Storytellers does is that you're working at really quite a deeply personal level with young people. And though you shared some examples of this, I'm wondering if you can, I want to dig deeper into this question about how we translate the personal to the policy level. So any thoughts you have about how to facilitate that, or some of the challenges? I imagine it's not always an easy thing to facilitate that translation.
I think two things. One, it's first starting with valuing, and I know that sounds really simplistic, but valuing the stories and the experience of those who are most effective. And I think that that's an approach that can be, how then do we draw out the experience and I would say sort of the solutions that are built in to those that are, those that are obviously thinking about it and living it every day. And then finding mechanisms to actually capture those and move them. So we did it in a very simple way for this project, which was just to have some very simple tools for people to capture stories like you would any kind of a rigorous research process. Capture those, collate them, find themes, and then as people who are facilitating that process, it's then learning how to translate those themes and those stories on the ground, being able to translate those then to the decision makers. So I think my role, anyway, as an organizer, and I'm sure many of us have a similar role, is to be that translator and that linker. So it's taking what we're hearing on the ground from and then working hand in hand and side by side and in solidarity with those that have shared those stories to then translate those, and almost making it simple for policymakers to see first what their role is, but also then how can policies that they directly have influence over make a difference on the ground. And that's not always a taken for granted thing. I think working on both levels and then being that translator or linker in between is really important.
Thank you. So there's a comment and question here from a couple of the participants saying, I agree with Melanie that Aboriginal communities have been the first and most visible example of the terror attendant on the collapse or byproducts of modernity. Local food choices such as Ulacan in the northwest were healthy choices now replaced with potato chips in a generation growing up who don't like taste. But many of the communities are beginning to rethink their relationship to food and how to reclaim elements of traditional food sovereignty. And this may also be partly fueled by the expense and inadequacy of the industrial food system supply. How can we support these pioneering efforts that may offer lessons for the rest of us? Do you have thoughts about that, Melanie?
I think that is, whoever said that, that's hitting right to the heart of what our experience was, is it's validating what's on the ground. A lot of the media influence that young people, especially in our community, have been told that somehow the things that they grew up with, which was exactly you're saying, the Ooligan in our community, it's the salmon. Every year it's going to the smokehouses, it's the canning as a family, it's the getting through the winter because you've put huckleberries in the freezer. Those sort of practices are not new, and the rest of the world is trying to reclaim them. But communities like northern communities like ours and other Aboriginal communities, they hold elements of what the rest of the world needs to see. So I think it's, in our case, it's been about supporting and shifting a perspective that young people, we have the answers often in smaller communities like this. And how do we validate that? How do we highlight those stories? How do we start to almost shine a light on these are the practices that that almost need to be examples for this media-saturated sort of society that sees other all the time? How do we find ways to almost share those stories back? So I completely agree. I don't know what those creative ways are, but I just know that that's some of the work that we've been doing as well.
Thank you. So I'm aware of time, and I want to make sure we have a chance for other people to weigh in with questions and open up the discussion more broadly to everyone on the call. And both Phil and Melanie, if you'd like to contribute any ideas. We have a few questions on the screen. Some of these I feel like we've talked about already. These were just to sort of give us some starting points for our group discussion. But maybe I'll turn it back to Phil to weigh back in on some of the conversation that we've been having. And looking at the second question we have here on the screen, how can we create policy change regarding healthy weights that goes beyond this sort of individualistic approach? I think, Melanie shared some examples that go a lot deeper than that. But Phil, would you like to give your thoughts on this?
Yeah, I think there's two things that strike me, is that we have heard some inspiring examples of people doing things that come from the heart at that local level. And I think that's the first thing that we can genuinely support each other and encourage each other in. The most effective examples of change that I'm observing are people who have, for want of a better word, a vocation. This is something they just need to or want to do. But the other side of it is that we create the policies that arise from the consciousness of our communities and countries. And the consciousness that we currently have in countries like the UK and Canada create the policies that we have. And so it seems to me that there is a very real link between these small-scale consciousness-changing activities at local community level and a wider change. That's why I think this historical analysis is relevant. I mean, the world did change as people's consciousness of how to be modern people living in the modern world changed. What we're trying to discover now is how to be people who live in the period past that. And we take inspiration from each other. And so I think that rather than saying there's this, I mean, there's lots of ideas around, aren't there, around food policy, and we should be promoting them, but I would see them as parts of those previous waves. If we ask the question, how do we move further forward to that, I think the key task for public health is to create a widespread awareness that we can't go on with business as usual, that the change needs to come. We take inspiration and examples from those that are doing it. And when that consciousness change, we'll come up with the policy that supports it.
Melanie, do you want to add any thoughts about this? I mean, what struck me in your presentation was your example of the work you did with the youth and coming to the place of recognizing the role of poverty in influencing health choices. And so often I think we see campaigns or approaches which oversimplify what we're working with here, and the idea that we can just make the healthy choice the easy choice and therefore we'll solve the problem. It sounds like that wasn't your experience. Do you want to add any thoughts about that?
Well, I think, I mean, you're bang on. I think when we started this project, we, like we often do, you leap in and do what seems like the most simple way to do it, which was go right to the issue. And then, of course, you start to think we need to pull right back because we're not addressing those core and underlying issues, which in this case, definitely it is poverty in our community. That might look different in other communities, but I think unless you approach with a comprehensive approach, which I think is sort of what we're talking about here, which takes into consideration health, environment, economy, all of those aspects in a very holistic way, we're always just going to try to campaign on a single issue. And I think these are such joined-up issues, and they require joined-up solutions.
If I could quickly jump, you were asking for a specific policy. There is a quite radical specific policy, which in this country is called the citizen's wage. Every citizen in the country gets a living wage as a birthright, funded by the state, and makes the danger of real poverty impossible. It also gives them the confidence to try new things in lives, to go through retraining and so on and so forth. It's expensive and would put up the taxes of those in in work, but it would be a real assault on poverty. At the moment, there's no chance that that will be taken forward in the UK because the consciousness to support it is not there. But when we recognize that we can't go on the way we are and that we need to change not just food, but the whole way we form and live our lives, then these are the kind of policies which I think will come through to help make some of that policy, poverty alleviation possible.
I want to acknowledge some comments in the chat room from Kate about the role of health literacy, and she's indicated that there's a diverse variety of stakeholders sharing best practices online around health literacy and raising awareness about health literacy. And so I'm wondering if either of you would like to comment on the role of health literacy in creating change. She has a specific question. How do we encourage our governments to move from just supporting best practices in kind of pilot programs to actually really supporting health literacy as an approach? So I'll throw that out to either of you, Melanie or Phil.
The comment I would make is that I think health literacy is another aspect of what I've been calling a change in consciousness. It is being able to understand and read what's going on round about you and understand why it is as it is and what it would take to change it. And I absolutely believe that that's fundamental. And unless we can allow that to happen across this wide spectrum of issues, it will be hard to make progress. The smoking ban that came in the United Kingdom was proposed by public health people for a long time, but it was as the awareness and consciousness of the public changed that the policymakers were emboldened to bring it about.
Melanie, any comments from you about?
Yeah, I absolutely agree. We've worked on a number of health literacy initiatives in the Hazeltons as well, and I think, Kate, I would link it back to those comments about resiliency. I think we've found definitely there's the skills, knowledge, and confidence, which are all three important when it comes to someone having the ability to take control of their own health. But I think that can be sort of pulled back and summarized in that resiliency, which is sort of a person's ability to take control of their own lives in no matter what those conditions are. And so I think I've seen some really interesting examples of health literacy being moved forward, and I don't know if I'll send the link on to Stacey, but there's been some really interesting work in BC, especially on that. So hopefully that can be shared.
Thank you so much. So I'm aware of time, and while I know and see that there are some additional questions, unfortunately we're not going to have time to answer them all here, though hopefully there'll be an opportunity for a future conversation. I want to point out a few things before we wrap up. First of all, at the bottom of the screen, we've provided a few web links that you can go to for more information. So first of all, on the BC Healthy Communities website, all of the presentations that were shown today are available for download. So if you'd like to connect there, you can. We've also provided a link to the Healthy Families BC Communities website if you'd like to check out and find out more information about that initiative. And there's also a link here. We will be sending out a link for your feedback on this session. Really does help us to get your feedback and know how we can improve these sessions in the future. So just wanted to point those all out. I want to say a big, big thank you to both Phil and Melanie for your time and your thoughts and taking us to the places that you did in this conversation. Deirdre, I wanted to also give you a moment to see if you had any final comments and how this connects with the work you've been doing on Living Life Fully.
Well, we're excited. We've been shortlisted to participate in a second phase, which would be a 4-year process to expand the work that we're doing on the ground into several new communities across Canada. And 4 of those will be within British Columbia. So that's pretty exciting from our perspective. And so we're just madly working on pulling all the pieces together for that and submitting for the next phase. So we're really hopeful about that.
Fantastic. There's a question here about accessing a recording or podcast of this session, and yes, it will be available on the BC Healthy Communities website following the session, so you can go there for the link in the future. And also, Claudia's just added a couple of other great links that you might want to check out. One is the After Now project that Phil's involved with. And Phil, do you want to just very quickly tell people what kinds of things they can find on the After Now site, because there's fantastic resources there?
Yeah, the Athenail site summarizes all of the work that we've been doing, and there are some videos there are some podcasts that do it in more detail, and there's lots of papers. So there's a combination of analysis of where we find ourselves and examples of people who are doing things that have inspired us.
And the videos are just great, short little videos that really capture a lot of what we've been talking about today. So again, a big thank you to our speakers and a big thank you to all the participants on the line and for all of your contributions to the conversation and the dialogue. We look forward to more of this, and we will be having future webinars, so please stay tuned. As part of our work with the Healthy Families BC Communities Initiative, we are looking at continuing learning opportunities like this, so we look forward to connecting again. Thanks, everyone.